Hello, everyone, and welcome to May's Age Well series event titled How Loneliness and Social Isolation Increase Dementia Risk. This webinar is presented by the Wisconsin Institute for Healthy Aging, or WIHA, with funding from a 2023 through 2028 CDC grant, Building Our Largest Dementia Infrastructure, or BOLD. Before we get started, I just want to do a brief overview of the Wisconsin Institute for Healthy Aging. So our mission is to improve the health and well-being of all people as we age by disseminating evidence-based programs and practices and by engaging in collaborative public health strategies in Wisconsin and beyond. If you have not yet signed up for our Age Well newsletter, we would encourage you to do so and learn more about us at our website, wihealthyaging.org. Today we have a wonderful presenter, Dr. Susan McFadden. She is a presenter emerita of psychology from the University of Wisconsin-Oshkosh. So we are looking forward to her as a presenter. She retired from the university in 2012 and now volunteers in many capacities for Fox Valley Memory Project, a nonprofit she co-founded in 2012. Fox Valley Memory Project's 13 monthly memory cafes provide joy and meaningful social connection for people living with dementia, their care partners, family members, and friends. She is a member of the lead team that developed the Memory Cafe Alliance to support sustainable growth of memory cafes, particularly in under-resourced communities. Dr. McFadden, thank you so much for being here today, and I'll turn it over to you.
Thank you. Okay. I'm going to share my screen. There we go. Is that up? Everybody can see that?
Perfect.
Okay. Thank you for giving me this opportunity to talk with all of you today. I'm just delighted that you gave me this big assignment, and I'll tell you in a minute why this is such a big assignment. But I just wanted to note that I have my email address on this first slide and encourage you to be in contact with me if there's anything I can help you with. I would be glad to correspond with you. And I also put the URL for our Fox Valley Memory Project on this first slide. You'll be hearing a little bit more about that later, but that is the nonprofit up here in Northeast Wisconsin that works in Outagamie, Winnebago, Calumet, and Wapaka counties. So there we are. Okay, so we're going to dive in, and I'm going to tell you what I'm going to talk about today. So here's an outline. Let's make sure I can. There we go. We're going to start with a couple of round images. You'll understand what that means in a minute. And I'm going to really affirm that this is a very big topic that you gave me to talk about today, and I'm going to show you some of the attention that it has attracted in recent years. We're going to define social isolation and loneliness. We're going to talk about who is lonely and who is socially isolated. And then we're going to talk about dementia risk factors and how complicated that is. And finally, we're going to end up with an argument that this is really an issue of public health and making community connections. So that is our assignment for the afternoon. And there are a few quiz items, only 3, and they're not hard. They're kind of fun. And we'll pause for these quiz questions. So let's dive in with our first round image. If we can make this work. There we go. So it's a pizza. Why am I showing you a pizza? Well, first of all, this is a pizza that I knew nothing about when I moved to Wisconsin in 1983. It's called a tavern-style pizza. And in New Jersey, pizzas did not look like this. But they're very good, and we discovered them when we moved to Wisconsin. So the reason why I have a pizza on this slide is because in 1993, long time ago, I was a professor at UW-Oshkosh, and I was asked to give a noontime talk to honors students. And then they were promised to have pizza. So it was pizza and professors. So I was thinking about, well, what can I talk to them about? I was teaching courses on the psychology of aging. And in 1993, I was also writing a journal article about loneliness and older adults. And I thought, well, I'm thinking about loneliness in older people. Maybe I could talk about loneliness and college students. And I was completely shocked in 1993 as the students kept pouring into this room in one of the buildings on campus where they were serving the pizza. More and more students kept coming. They were sitting on the floor. They were standing. They were not there to hear me, and they could get pizza all the time. They were here because they had heard I was going to be talking about loneliness. And this is what was so shocking to me, that it was such a salient topic for these students. And I've never forgotten that experience. So think about that. That was 93, and college students thinking about loneliness. Now, my next slide is another round object, which I'm sure you'll all recognize, because this is the image of a COVID-19 virus that we all saw so many times on our television sets and in magazines and newspapers, etc. It's a round object that made us really, really aware of how serious it is for people, especially older adults, to experience social isolation and loneliness. We all remember what it was like when we had a loved one in a nursing home and we could only talk to them through the windows. Um, and or we couldn't visit, and maybe we could have a phone call, but some didn't manage phone calls well, some didn't have phones, etc. So this round object on your screen really set forward a ton of research on social isolation and loneliness, but my students in 1983 were already thinking about it. So now I'm going to take you through some publications that are on this topic and tell you briefly about what some of them said. This first one I'll come back to a little bit later in my talk, but I wanted to show it to you first. Came out from the National Academies of Sciences, Engineering, Medicine in 2020. Social isolation and loneliness in older adults, opportunities for the healthcare system. Now, there are a lot of things about this that I really like. First of all, that they have connected social isolation and loneliness with the healthcare system. I mean, how many times do you go to a doctor and does your doctor ask you about loneliness? They'll probably give you the 3 items from the UCLA loneliness scale. But if you're a care partner for somebody who's living with dementia, how often does your doctor actually ask you about what it's like to be a care partner? Not enough, I would argue. But the other thing that I like about this is from the cover of the book, is think about these people in these apartments. Do they know each other? Do they call each other by name? Do they recognize one another in the elevator? Or are they pretty socially isolated, and are they feeling lonely? The back cover of this book has a similar picture of the same apartment building with some lights on, some lights off. Now you see that this publication came out in 2020, but I need to tell you that the papers in it, it's got a bunch of chapters, they were all written in 2018 and 2019. So that was before any of us ever heard of COVID. So think about that for a moment. As I said, I will return to this. This next slide is a booklet that came out from the National Institute on Aging, and it came out in 2020 rather, in November. So it was after the pandemic had started. So in this booklet, which was meant for older adults, there are a couple of pages, and I've got the pages up here, that deal specifically with the COVID pandemic. And if you look in the second paragraph in that middle part that I have copied, it says older adults are at greater risk of COVID-19, but it is also critically important for them to maintain active social connections. It was hard, wasn't it? It was really hard. If you look over on the right, the precautions people should be saying, should be taking. We know that we were supposed to stand 6 feet apart from one another. This is a bit amusing because in the middle of that paragraph it says, cover your mouth and nose with a cloth face mask when around others. I remember going to Fleet Farm and buying dish towels that I made cloth masks out of. And then, of course, we found out they were completely useless. But anyway, NAA was recommending this at the beginning of the pandemic. So this was a booklet that was talking about the importance of social connection. Here's one that came out a few years later, came from the Office of the U.S. Surgeon General. I don't particularly like the title of this book because it talks about an epidemic, and I always get upset when I hear people talk about things like an epidemic of dementia, which I hear all too often. And this one, an epidemic of loneliness and isolation. Well, in epidemics or pandemics, we're supposed to stand apart from one another, right? So but you know, people who live with some type of dementia, they need social connection. So I'd prefer it if you did not call it an epidemic, but nevertheless, that's what this publication was called. And here is one of the most publicized findings from this book, that lacking social connection is as dangerous as smoking up to 15 cigarettes a day. You've probably heard this. This information got around. That Julianne Holt-Lunstad, you can kind of see her name down at the bottom there. She's the one who did this research and came up with this conclusion that lacking social connection is bad for our health. Here's another quote from that book, that among older adults, chronic loneliness and social isolation can increase the risk of developing dementia by approximately 50%. And that came out from some research in 2021. So that increases your risk of having this lack of connection to other people and feeling the stress of that negative emotion of loneliness. We'll get to that in more detail in a minute. Here's another book. This one came out from the World Health Organization in 2025, From Loneliness to Social Connection. Now, this is a publication that is meant to be spread around the world. They are taking information from countries around the world, and their focus at the World Health Organization is on how governments and nonprofits, NGOs, etc., can encourage health in the societies around the world by addressing loneliness and social isolation. So I thought that that was really important, that now it's talking about this on a global scale, and it's talking about it in terms of health policy, which is very important. All of this goes together under the rubric of social determinants of health, sometimes abbreviated SDOH, social determinants of health. That is, that we think about health as being caused, or lack of health, perhaps being caused by a virus or a bacteria. But here we're saying that there are things out in our society that directly affect our health. I'll say more about that in a few minutes. But remember, social determinants of health. So let's get some definitions here. Loneliness. Loneliness is this negative emotional feeling that comes when there's a difference between what you want in terms of connection with other people and what you actually experience in terms of connection with others. And we know that it is quite possible to feel lonely in a crowd. As a matter of fact, there is a famous sociology book that was written a number of decades ago called The Lonely Crowd. So, this topic of loneliness has been around for a long time as it's been examined by social scientists. So, it's this negative emotional feeling. It is stressful. And we know that stress can have negative impacts on our whole bodies, including, of course, our brains. Social isolation we define as a lack of social contacts and having few people to interact with regularly. So somebody can be socially isolated and not feel lonely, and somebody can feel lonely and not be socially isolated. I hope all that makes sense. I'm going to pause for our first quiz question. Can we get that up on the screen?
We can see it now.
Mm-hmm.
So if everybody wants to respond to the question. We'll give people about 5 more seconds. All right.
Oh, that's very interesting. Okay. Well, the answer to this question is actually C, which was the lowest percentage that any of you gave. That's fascinating. Now, older retired men, we know, often do become disconnected from social networks because of their having had social networks with their work. But it's these middle aged men with no college education are the ones who really get socially disconnected from networks, at least according to recent research by sociologists. So, older retired men, yes, they do suffer from social isolation and loneliness, but it's those middle aged men who really are having trouble finding work now, feeling like they are valued in our society. They're the ones that may be struggling with a sense of disconnection from social networks. So let's go on, if we can close that. Okay, let's go to my next slide. So who is lonely and who is socially isolated? Well, from the World Health Organization again, loneliness is most common among young adolescents and young adults, but social isolation affects 1/4 or more of older adults. So think about that. This negative emotion of loneliness is most common among adolescents and young adults. And this would definitely argue, if you put these two things together, it would argue for more intergenerational opportunities. I have seen young people, adolescents and young adults, just glow with happiness when they are having opportunities to interact with people living with dementia. I could see that in my students when they would go to nursing homes and volunteer there. I've seen it in our memory cafes. So we need to find more opportunities for these adolescents and young adults to get together with older people. So, what is the connection to all of this and dementia? So, we have our next quiz question. So, if we could put that up.
And I'll just read that real quick. So, dementia
Okay.
is another word for Alzheimer's, a condition that emerges exclusively in people 75 and older and primarily affects memory. True or false? You could take a second and respond to the question. Give another 5 seconds. All right.
Ha, good. Yes, the answer is false. So we know that there are many, many different types of dementia. Although you often hear people talk about just Alzheimer's disease, we know that there are many other kinds of dementia, vascular dementia, and Lewy body disease, and frontal temporal dementia, etc. And I am starting to see a bit more care taken to identify these different dementias. The place I'm primarily seeing this is in obituaries, where somebody who had, say, Lewy body disease or Lewy body dementia, that's in the obituary, like Robin Williams, for example. Um, so definitely the dementia is not the same as Alzheimer's disease. And dementia can affect memory, as we know, but it affects other things as well. It can have effects on vision, it can have effects on balance, and um, other aspects that the brain is in charge of. It's not just about memory. Okay, let's go on to the next slide. Here's a very typical definition of dementia, which is an umbrella term that I'm sure you all know that. This comes from the Alzheimer's Association. Progressive decline in mental ability severe enough to interfere with daily life. I like that definition a lot. The key term in that definition is progressive. This is a progressive condition, so that any kind of programs and services that we design for people living with dementia, we need to keep in mind that things are going to change, not just for the person living with dementia, but also for the care partner. Now I have my last um, question for you. So, does anybody? Okay, there we go.
So, which of these problems is associated with a greater risk of dementia? Hearing loss or vision loss? Please take a second to respond. We'll give a few more seconds. All right.
Good. The answer is hearing loss. I used to ask my students, when I would be talking about sensory issues with older adults, I used to ask them, what do you think is worse, to lose your vision or to lose your hearing? And by and large, the students would all say, oh, vision. It's not vision, it's hearing. Because with hearing loss, we then cannot be as well connected with other people in conversations, and we miss out on a lot. And so I will show you another slide in a little bit that will demonstrate this issue about hearing loss and dementia. Okay, ready to move on? I'm about to show you a really, really messy slide. So I hope you're ready for this. It's going to show you lifespan, and I've put it from 0 to 80, but I could have done 0 to 100. And at the top, I'm going to show risk factors for dementia. And on the bottom of this very messy slide, I'm going to show you protective factors. So here it is. Ta-da! So, you see why I said it was messy. At the top, yes, genetics. Yes, there are a few types of dementia that are genetically related. One in particular, Huntington's disease, we know the gene that causes Huntington's. But for Alzheimer's, it's a particular type of rare gene, genetic change. Um, we don't know enough about the genetics of dementia. But look at all these other risk factors. How economic disadvantage across the lifespan is a risk factor for dementia. It increases your probability of having some type of dementia because you may not have had access to good health care. You may not have had access to education. You may have lived in an environment that there was a lot of pollution. You may have lived in an environment with a lot of stress. And that can be a risk factor across the lifespan, increasing the probability of dementia. So we know that this is true as we look at different groups in our society that are living with dementia. We also know that depression and head trauma, we hear about that a lot in terms of the chronic traumatic encephalopathy with football players when they get hit a lot. We know that that's a risk factor. Hearing loss is right up there. Life habits, smoking and drinking, although the smoking not as much as being socially isolated, and then various vascular risks. So these also are experienced across the lifespan. But there are protective factors as well. So on the bottom, we've got economic advantage, education, diet and exercise across the lifespan, and then, of course, this positive social network. Um, within the positive social network, you are getting cognitive or mental stimulation that you are not getting if you are sitting at home by yourself with the television droning hour after hour after hour. So those are protective factors across the lifespan. Now, to make this a little bit easier for you, instead of this very messy slide, I'll show you this slide. We can say that it is a good idea to walk to a Greek restaurant with friends. And what I mean by that is that we know that the Mediterranean diets, the Greek diet, it's high in fish and vegetables and fruits and low in processed foods. That's good for you. You're walking with friends, so you're getting that social connection, that social stimulation, and you're walking. You're getting exercise. And you want to make sure you can hear your friends, right? You want to make sure that your hearing is good. So we're going to get back to that topic of hearing loss and dementia. It is said to be the largest modifiable risk factor for developing dementia. Modifiable. You cannot modify your genes, right? You can't, when you get to be 78 years old, you cannot modify the fact that you grew up in poverty. You did. And that's a part of your life story. But hearing loss is modifiable because now Medicare covers getting hearing aids. And it's, as I say, more than smoking, high blood pressure, etc. And the harder the brain is working to process sound, the less ability it has to perform other cognitive tasks. So you're working really hard to hear what people are saying in the room, and you just don't have much left over for thinking about what is being said in the room, thinking about what you might say next. And of course, we know that hearing loss can lead to social isolation. So think about that the next time somebody says, "Oh, I don't want to wear my hearing aids because I'll look old." Um, No, you want to wear those hearing aids. So, here's another quote for you. The evidence indicates that less frequent social contacts and lower levels of participation in community groups are associated with declines in global cognition, processing speed. That means how much time does it take for you to get information, think about what you might want to say in response, get it out, etc. Executive function, that means your higher order decision making about life, and your vision and your spatial abilities, your ability to know where you are in space and have depth perception, etc. And there we are again with this picture of the apartments, and a few people had their lights on. So this quote comes from that document. So you know what I was thinking about as I read this book? Um, I was thinking about a Beatles song. Any of you think about Eleanor Rigby? Do you remember this song? It came out in 1966 from the Beatles. All the lonely people, where do they all come from? All the lonely people, where do they all belong? It's a gorgeous song, and it was sung by the Beatles in 1966, and it's really about older people. And that was remarkable that this rock and roll group that, young girls were screaming at um, was singing about loneliness in 1966. So, what are we going to do about all this? What are the solutions? Well, here's a popular solution that everybody would love to have happen. That is, that we'll pour a lot of money in, we'll get these smart researchers, and we'll get a pill. So we'll fix this with a pill, with some kind of medication. Can we really fix this with a medication? Can we fix the fact that you grew up in an environment with air pollution and lead paint in your house and water like Flint, Michigan, and you didn't have an opportunity to get a good education, and you've had a very stressful life, and maybe you've had a few head injuries, etc. Can a pill fix all that? Because all of those are risk factors. But, we keep hoping for that magic pill that is going to do this. Well, let me give you some other solutions. Public health. And I'm going to work through these 4 categories. All of them are supported by research. And all of them come under into this category of social prescribing. Social prescribing means that healthcare professionals, whether it's your doctor, your nurse practitioner, your physician assistant, in addition to prescribing pills, they can prescribe you going to a memory cafe, which I'll talk about in a few minutes. They can prescribe the fact that you ought to go to a concert once a month. You ought to go hear your symphony play, or you ought to go see a play. And if you can't afford that, right? You say, oh, the tickets are so expensive. Then people who are working on social prescribing are finding ways to have insurance companies cover things like the cost of the tickets, even transportation. This has been rolled out in the UK for a number of years. It's really taken hold in Massachusetts, and we have a Wisconsin effort on social prescribing happening now. So if you want to find out more about social prescribing, just go to socialrx.org, and you'll find out about the national group, and then you can do a Google search for the Wisconsin social prescribing. It is coming. When your doctor might say, go to a nature center once a month. So let me give you some examples of these 4 categories. This first example comes from a program that many of you know I love very much and I've worked with for over 25 years. Time slips, creative storytelling. It's a lot more than storytelling now. It's really about creative engagement of all kinds. So these lovely pictures show the creativity of making costumes, of performing, of singing together, um, and telling stories. So, the arts and health. We now have lots of research that demonstrates how good various art forms are for your overall health, including your cognitive health. There's a new book out right now by a wonderful British researcher that's called Art Cure, and she summarizes all these different ways that the arts have been shown through very good research to have positive effects on health. And these are just some joyful examples in these pictures from time slips. I want you also to know that in Wisconsin, I hope you have heard about the Spark programs in Wisconsin. We have Spark programs in 24 arts and cultural institutions in this state, more than any other state in the country. So these are programs that take place in museums and arts and cultural centers where people living with some type of dementia come with care partners and they engage with the arts. Now, do we have research that shows that this will cure their dementia? No. Do we have research that shows it may slow down the progression of the dementia? We're starting to get a little bit of research on that. Do we have research to say that it improves your overall sense of well being and your feeling of being connected in community and your feeling that you now have an important social role? I go to museums. Yes, we do have research that shows that. And increasingly, healthcare organizations are recognizing the importance of arts for health. And we can be just so proud that we have so many opportunities for people in Wisconsin for these kinds of things. Here's my next slide. This comes from a wonderful opportunity that my husband and I started in 2018, Memory Camp. We have this camp for 3 nights and 2 full days in northern Wisconsin. Gorgeous camp by a beautiful lake. And nature and health. We have lots of research now that demonstrates how important it is for older adults in general, and including people living with dementia, to get out into the natural world. I often say that older people and people living with dementia are nature deprived. And this man was not for the time he was at nature camp. He spent quite a bit of time going around the campsite by our fire circle and collecting these rocks and these sticks, and you can't really see them, but there were some pine cones in there, and he was carefully arranging these things. So he's got art here in combination with nature. There's a very famous Scottish artist that some of you may have heard of named Andy Goldsworthy, and he does art just like this man with dementia did. And he was, as I said, he was just so proud of what he had put together here. So we sit by the lake and we take hikes through the woods and we just enjoy being in a natural setting. I'm delighted to tell you that Fox Valley Memory Project has now just announced that they are collaborating with Heckrod Nature Center in Menasha, Wisconsin, to do programs for people living with dementia and care partners at this nature center. And I just could not be happier about this because we have a lot of research that demonstrates how important this is for brain health as well as for overall health. Now, this next one, whoops, I don't know why it went backwards. This next one might surprise you a bit. That I'm a psychologist. I'm going to talk about spiritual practices and participation in faith communities and health. Well, yes, I am going to talk about this because we have had research on this connection of religion and health for over 100 years. It has not been research that has just come out since the pandemic. This research has been going on for a long time, and it particularly started to take form in universities in the 1950s. In the 1980s, there started to be funding for this kind of research, in the 1990s, etc. Now, you're not going to have a doctor who is going to prescribe that you should go to church. That would make everybody feel uncomfortable. But your doctor might understand that you regularly attend a service. This service, this pictured one on the right, comes from the church I go to, actually. You see white haired people there, but you also see younger people. What you don't see is that children come forward and uh, gather on the chancel and have a children's sermon, and then they go out to church school. So there's an intergenerational opportunity there. Here they're standing, they're singing. Now we've got the arts involved. They're listening to music. And then there's quiet time. They get hugs from friends and other people they may not even know. There are often treats at coffee hour, so you get that. So that is very important for health, and we have a lot of research that shows that. And as well, different spiritual practices like prayer and meditation and reading sacred scriptures. All of these things that can reduce stress, can reduce anxiety, can make people feel connected to the ultimate, whereas they may have trouble feeling connected to their next door neighbor, but they feel like they have some important connection to God. This is important for health. So I just want to make sure you understand that, even though it may not be socially prescribed for you. And we come to this one, social connections and health. Again, lots of research on this. These three pictures come from memory cafes at that are sponsored by Fox Valley Memory Project. I love showing the snake picture, but I always tell people you don't have to have a snake at a memory cafe. But memory cafes are marvelous opportunities for the care partner and the person living with dementia to enjoy time with other people who understand what you are going through, who understand that you may be feeling socially isolated, but you have taken a step, a courageous step. I always say it takes some courage to go to a memory cafe for the first time. You're maybe in a library, or you're in a nature center, or an actual cafe. You don't know anybody, you don't know what it's going to be like, but you're welcomed there. And if you're the care partner, you don't have to feel the stigma of dementia that you might feel when you and your loved one go to a restaurant, or when you and your loved one go to a store. You don't have to feel that, because everybody accepts you and they welcome you, and they have created this safe, stigma free place. And that, I would argue, is good for brain health. All of that is good for brain health, because we know that these kinds of social connections are important. And does it slow down the progression of the dementia? It might. And we have more research coming online now that is starting to demonstrate that people who regularly attend things like memory cafes may have the may experience the slowing of the progression, even though we know that everybody's dementia is different. Nevertheless, there is an effect on the brain when we have these meaningful social connections. So now I want to tell you about a particular memory cafe that I coordinated. I volunteer at a memory cafe at a library in Kaukauna, Wisconsin. And we had an afternoon at this memory cafe with the theme of loneliness and connection. So this was a couple years ago. I was thinking about this, of course, as we came out of the pandemic, as we were once again able to get together with people. I was also thinking about this because my good friend Ann Basting, some of you know Ann, she started Time Slips um, back in the late 90s. Um, she was working at the time at UW Milwaukee, and she was directing the Center on 21st Century Studies. And they put together a program after the pandemic on loneliness and connection. And so I decided that I would see what we might get if we had that as a theme at our memory cafe. So I came to the memory cafe with a lot of colored paper and colored pens and scissors, and I wanted people to create something that expressed how they felt about loneliness and connection. And this came from a mother and daughter who were working together. And so it was the daughter who was cutting the black paper out and putting it on the white paper that I brought. And that was her expression of loneliness. But look at the expression of connection. So the mother and the daughter worked on that together, and I remember distinctly the mom had the colored pen, and she very carefully was going around and putting all those dots and lines on those colors. And this was there's movement in this. There's interconnection in this. There's happiness in this. Whereas the one on the top, you don't see any of that. But here are two people, two older adults, one of whom has dementia, who have together created this demonstration of what loneliness and connection feel like. Now, my last slide, I need to say a little bit about before I show it to you, because I have a quote, a couple of quotes actually, on this last slide. And I have the name of the care partner who gave me these quotes. And the reason why I have her name is that she allowed me to use that because we took her creation and we displayed it in a gallery down at UW Milwaukee for this whole program that the Center for 21st Century Studies was doing on loneliness. It was called Lonely No More. And she was so proud to be able to have something that she had created at a memory cafe in a gallery for anybody to see. And so this is what she created. She says, loneliness is a form of brokenness with its jagged, raw edges. So you see there's similarity between what she's done and with what the mother and daughter had done. But then connectedness shares and acknowledges the brokenness and provides support when life spirals out of control. And I think that's so beautiful because at memory cafes and when we have memory camp and when our Fox Valley Memory Project folks are going to be going to the nature center, and even when people are and in their faith community and they feel connected to one another, they feel like they're getting support when life spirals out of control. And this is a picture of her husband. Her husband suffered one of those rare viral infections that basically took out his hippocampus. It's an important part of the brain that is involved with constructing and retrieving short-term memory. So basically, he had no short-term memory. There have been other cases like this well documented. And he spent his whole time working on this picture. I'm not exactly sure what he was trying to say because he didn't have a lot of language, but I think it's profound. There he's looking at you. The eye is looking at you. He's very carefully cut those thin strips of pink and glued them on. And he's saying something about being connected, even though he no longer can really speak. And yet I feel like this opportunity to be together for both of them was important. And I'll never forget, as they left that day, as they left the Memory Cafe that day, Maria said to me, after she had made her paper creation, she said, "This is the first time all day I have relaxed." And, think about how important that is. She was with other people. It didn't matter if her husband couldn't speak, it didn't matter if he couldn't remember things. She knew she was with a group of people that accepted both of them. And I have to believe that that was very good for their health, for both of them. So, thank you. And I will turn it back to the WeHa people who will take us to the end here.
Wonderful. Thank you so much, Dr. McFadden. We will get to questions and answers in just a couple of seconds. So if you have any questions, feel free to enter those in the chat. Just a couple of quick things before we get to that. You will be asked once you exit Zoom to complete a survey. We would really appreciate your feedback in completing that survey, so please do that. And I'm just going to run through a couple things on our website. If you visit us at wihealthyaging.org and you come to the programs and find a workshop right in the middle of the page here, you can see a list of all of the workshops that we offer and where they are located across the state. So please feel free to check that out and see what workshops are available near you. The Age Well series presentations is under our Age Well and then Age Well series dropdown. You can see all of our past events and as well as our upcoming events. So we do have our upcoming June events on June 24th on Purpose. So we would encourage everyone to register for that event as well with Dr. Stacy Schaefer. And then I think the last thing that I just wanted to review is if you found this event helpful today, we would greatly appreciate a small donation. You can use the give button on our website and adjust that however you see fit for just a small donation, and we would really appreciate that. So we will turn it back over to Dr. McFadden and go through Q&A. And if you'd like to come off chat, you can do that as well. We do have a couple of comments in the chat just through the presentation. So Sherry shared that she started taking harp lessons at the age of 59. She loves playing and feels that her brain is being challenged. She's even thinking about becoming a certified therapy musician after retirement. So that sounds
Nice.
wonderful.
That's fantastic. Yeah, there's a lot of research now out there about taking up an instrument, learning a new instrument as an older person. And that's very good for your brain health. Absolutely.
Great. There were some comments about the snake picture and how amazing that was. Chris shared that her husband died of Alzheimer's in 2023. After his death, she self-published a book of her journal entries as she kept while she cared for him during the last 3 years of his life. She shared that it helped immensely with grief. He was diagnosed in 2020, and she's sure that that helped the disease progress more rapidly as well.
Oh, yes. And again, lots of researchers are looking at that. I think we still have not come to terms with the effects of the pandemic on persons of all ages. You read about kids who are behind in reading and math, but families that had a loved one die, that they couldn't be with that person. They're still carrying that grief. And as I say, I just don't think that we've come to terms with it. Yes, it was 2020 and this is 2026, and we don't, most of the time we don't wear masks, but there's still a lot of trauma that is left over from that.
I don't see any other questions Um, there was quite a few comments. Great presentation. Thank you for the information shared. A few people commenting they learned something new today.
Oh,
So we
good.
appreciate that. Yes. Wonderful. We'll just give a couple minutes yet. We do have some time for question and answer, so please feel free to add your question to the chat, or if you're comfortable coming off mute, you can ask the question that way as well.
So this business about Zoom meetings, this is something we didn't have 10 years ago, right? And we are able to connect this way. It's not the same as being in the same room with one another, but it's still a good step forward in terms of connecting people, I think.
Yeah. There is a question on will we be able to re-listen to this presentation? And yes, everyone who registered for the presentation will receive a recording, and that will likely be sent out tomorrow.
Okay.
There is a question on can you speak to options for care partners to lessen social isolation other than memory cafes?
um, Yeah, I mean, there's the common thing that care partners just want to demonstrate to the world that they can do it all, right? Certainly, my mother was one of those. Um, and yet, she was caring for my father for 11 years, who had a major stroke and vascular dementia. And she was not inclined to ask for help. She thought she needed to do it all. And I think what we need to do as a society is to break down this barrier of I have to do it all on my own, and to say to people, you know, um, we're in this together. Our community is in this with you. And we demonstrate that through in a number of different ways. In Wisconsin, for example, some of you have probably seen the Purple Angel decals on stores and libraries and YMCA's, etc., to say, look, you know, we understand that people have dementia, but you are accepted here. You do not have to stay isolated in your home. And the more we can get that message out, the better. And the other thing that I'm just really hoping will happen soon is that people in the medical community will recognize that care partners are hidden patients. How many people in the medical community know when they are doing the Medicare annual check that the person in front of them whose blood pressure they're taking and, vitals and all the rest, how many of them know that they're in this 24/7 role of caring for their husband or their wife or their mother? I don't think that many know. And yet that is a health risk. And so we need to just spread this message. Um, and I hope it's getting out there.
Yeah. There was also just a comment, a response to that many public libraries are trained in being dementia friendly.
Yes,
So just encouraging people to use their local libraries as well.
absolutely. And many libraries in Wisconsin have memory cafes.
Great. And then there was a question on where can they find information on your memory camp that you and your husband have, and is that just for the person with dementia or the caregiver spouse as well?
It's for It's for the person with dementia and the spouse or partner, adult child. We've had ages 5 to 95 because grandchildren came. It is so fabulous. So write to me and I'll send you the information. Yeah, it's
Wonderful.
it's so much fun.
Great. I'm not seeing any other questions. We'll just give it a couple more seconds and then we can close out for the day. Anybody has any final questions? Feel free.
Oh, thank you for putting my email address up there. Well, I enjoyed talking to all of you. Thank you for inviting me to do this.
Yes, thank you so much, Dr. McFadden, for joining us. We greatly appreciate your time and what an excellent presentation.
Thank you. Take care, everybody.
All right, thank you, everyone.
Bye
Hope to
bye.
see you next month.